This is Bob Finn reporting from the annual meeting of the North American Society for Pediatric and Adolescent Gynecology, where Dr. Mehta explained that conducting a child abuse exam requires a great deal of expertise. What are some of the most common mistakes that physicians make when conducting these exams?
There are a variety of different mistakes that a physician can make when performing a medical evaluation of a child where there are concerns of child sexual abuse. Probably the number one mistake would be to feel that because a child has a normal examination, that suggests in some way that the child wasn't sexually abused. We know that the overwhelming majority of children, even in cases where there is videotaped evidence, confessions, very good disclosures, most of those children have normal examinations, and so that would be one of the main concerns. Other concerns that can arise when a physician is performing evaluations are lack of up-to-date training, lack of knowledge about the current literature. Sometimes when a physician is uncomfortable with performing these evaluations, there may be a tendency to try to turf this case to somebody that they feel has some experience. The caution there would be that, for example, nurses who are trained in adult sexual assault are not properly trained to evaluate children with concerns of child sexual abuse. Or sometimes a physician may think, well, I'll send them to a gynecologist because they look at genitals frequently, but the actual field of child sexual abuse evaluation is a specialized field, and I would recommend that physicians who work with that population of children maintain appropriate credentials, have not only a peer review process where they review cases with colleagues, but also an expert review process where cases of concern, where they think there are abnormal findings, are reviewed by someone from an outside facility who is deemed to be an expert in that area.
What are some of the tips you can give to an ordinary pediatrician or gynecologist who may be conducting this exam?
In terms of an examiner who's evaluating children for concerns of sexual abuse, examination position of the child can be very important. It can increase the patient's comfort as well as increase your ability to visualize what needs to be seen. One of the main positions children are examined in is the frog leg position, where they're laying on their back and their feet are together and their knees are apart, much like a frog's leg. The physician examiner, instead of just merely trying to separate the female genital area, it's recommended that wearing gloves, the physician examiner places their thumb and forefinger on the labia majora and pulls gently towards them and downward. A common mistake is for an examiner to try to flip things out or open, thinking that will increase visualization. That usually makes the patient very uncomfortable and can put tension on a part of the anatomy called the posterior fourchette, causing tears. So again, pulling towards the examiner and downward often helps bring better traction to view the child's more internal genital structures. I think one of the things that can be helpful for children, in addition to the physician or nurse introducing themselves, is to remember that it's important to keep concerns of sexual abuse. We may have an emotional response, for example, to the concern. We may think, oh, this poor child, or this is so terrible. But for children, they generally do not perceive themselves to be victims of a crime. And the more normalized a process can be for them, the better it is for them.
This is Bob Finn reporting for Global Medical News Network.